Good afternoon, everybody. This is Ceci from Illinois Action for Children. I think we're going to wait just 1 minute as people are getting online. We have quite a few folks registered for today's webinar, so we'll just give it 1 more minute. Okay, I think we are going to get started. We definitely have more people registered who are not on yet, but to be respectful for those of you who are on time, we appreciate it, and thank you for taking time out of your busy day to find out what's happening on the policy front. So again, this is Ceci Nyman. I'm the Vice President for Policy here at Illinois Action for Children, and I'm going to kick us off, give you a little sense of what we're going to talk about on the call today in terms of who you're going to be hearing from. I'll kick us off. Then we're going to hear from Samir Tana, our Assistant Director of Policy and our main force in Springfield these days, and he's going to go through the budget both for FY17 as well as the proposed budget that we heard from the governor last week, FY18. And then we're also going to hear from Maria Estlund, our policy associate, who is going to walk us through our state policy priorities for this current legislative session leading into FY18. So you'll hear from all three of us. We will break after the budget section to take budget-specific questions. I'm sure there are many, given that we are still in a state with no budget. So it's part of one of the many challenges of preparing for today's presentation and trying to understand which way's up. So, so I'm going to go ahead and get started. And I should say at the top of this, I'm sure many of you know that actually next week is my last week at Illinois Action for Children. I have had the pleasure and honor of working with and for all of you for the last 17 years on behalf of low-income families across our state who rely on the services that you all provide every day. I've learned so much and loved almost every minute of it. And I'm, it's with mixed emotion that I'm leaving. But, 17 years, I thought it's time to try something different, and I have a great opportunity to move and still working on some early childhood issues from a public health perspective. So I will be at EverThrive, Illinois, starting on March 6th. So I hope to see many of you and be able to continue to work on issues across both the public health and early childhood spectrum. So thanks for all you do, and definitely this is no time to let up. The environment is increasingly challenging for all of you as providers in terms of delivering quality care, and even more so for low-income families trying to get the best services, supports, and education for their children. So with that, again, so we're going to kick off with the FY17 budget and tell you a little bit of where we are in this very confusing state. And then move right into what we heard last week in terms of the governor's proposed budget for FY18. and then some of the key elements of specifically the budget around child care and other early learning programs, and then move into our policy priorities. So with that, I'm going to turn it over to Samir, I think.
Yeah. Hi. I just had to unmute my phone. Hello, everybody. Thanks for attending. I'm going to get started in just a second. I just want to make sure that everybody knows that if you have any questions, please feel free to fill them in on the panel on the right side of your screen. There is a drop down for questions, so we will be collecting those. And as Ceci said, about halfway through, when we finish the budget update, we will try to answer some of the questions you have. So let's get started. FY17, obviously, the state has not had a budget for 20 full months at this point. This is causing a lot of consternation for people, especially those not included in any of the stopgap or consent decrees or court order mandates. Currently, the state is running on three things. They're running on a federal appropriation, which there's a large amount. There's over $6 billion worth of federal funds that come straight to the state that they have to appropriate. So for FY16 and FY17, the General Assembly has passed that spending. That spending includes funding for the child care resource and referral system and for the funding of payments to center child care providers. Another way the state is moving forward are court orders. There's a court order to pay state workers. There's a court order to pay then home child care providers. There's a court order for some DCFS and child welfare services. And there's a court order to pay early intervention, among other things. There are also consent decrees that force the state to provide services to some children and families, and Medicaid is in that as well. So the state has unfortunately, or fortunately, however you want to look at it, been able to get by without having a full budget passed through the General Assembly. However, because we are not taking in as much revenue as we did in 2014 when the income tax increase expired, we are building back up our backlog of bills. So back in 2011, when we passed a tax increase up to 5%, we had about $7 or $8 billion in back bills. So over time of having that tax increase, we were able to bring our back bills down actually to under $4 billion, and most of that was being paid out within 30 days. So we were working on a regular 30-day cycle and making payments. But after the tax increase expired and the fact that we don't have a budget, and so we are not restricted in the payments we have to make on court orders and consent decrees, we are building up a large backlog of bills. We are at just about $12 billion as of a week ago. It is estimated will be near $15 billion by the end of the fiscal year. So we are not, we are going backwards rather than forwards, not only in what we're funding, but in how we're paying the things we are funding. So this is extremely concerning because all this has to be paid back. So any budget we have in the future, any revenue enhancements we have in the future, we have an additional $12 billion plus of expenses we have to pay because we have not had the sufficient revenue for the last 2.5 years. So moving on from there, the FY16 and the FY17 stopgap expired on December 31st. So that means there were some programs that are not funded through federal court orders and consent decrees. Those programs had what was called the stopgap funding. So they got essentially 12 months of funding to fund 18 months of services. However, that authority to spend ended at the end of the calendar year, and we've heard that actually programs were not getting paid for any services delivered after July 1st of 2016. So the money ran out. 12 months of money ran out. 12 months of money ran out in 12 months. Shocking. So while a lot of programs are still continuing to provide services like home visiting and Teen Reach, and many of these programs have signed contracts with the state and are not getting paid. Those are part of the the bills going into the backlog that needs to be paid in the future. And unfortunately, the governor had his budget address on last Wednesday, and he did not make one mention of the FY16 or FY17 budget in his address. So it's unfortunate that he did not see the urgency and the need to comment on these programs that are having a hard time getting by, especially because they're not getting paid. So moving on to the FY18 budget, like I said last Wednesday, the governor had his annual budget address, and he presented his constitutionally mandated proposed budget. There's, just like all budgets that are presented, in good times and bad, there are good things about the budget and bad things about the budget and impossible things about the budget. So the first thing that's good is the governor did propose increases to child care, your early childhood block grant, and other early childhood services like early intervention. These are positives. You can see that these are what we believe, something that the governor believes strongly in. However, he did eliminate some programs, including Teen Reach, the Autism Project, the Children's Center, saving, in his estimation, about $16 million. So those are the bad. And then the impossible is the fact that this budget has no new revenue. So if we take the estimates at their highest, we will receive in FY18 about $32.7 billion in income for the state. That will be their revenue. And the governor's proposed budget is at $37.3 billion. So you can see right there we're about $4.6 billion short because the governor did not propose any revenue enhancements. However, even further, adding to this mess is the governor in his budget proposed about $2.6 billion in savings, which includes things like a reduced contract for state workers, some procurement reforms, and things that we've seen in the past, savings that cannot be banked in the first year or if ever, if you look at the last time the General Assembly passed pension reform. So banking these savings in the first year is not a good idea. So in reality, the governor's budget, he would spend about $39.7 billion if these savings do not go into effect immediately July 1. So that puts us $7.2 billion out of balance. So now if you look at what the governor proposed, we have a chart here that shows what the governor's office said they spent on programs in FY16, what they're estimated to spend this year, and what their proposed spending in FY18. So you can see it looks good for child care, early intervention, the early childhood block grant, and there's a great investment into bilingual education. The home visiting line is, the governor's office did not have consistent numbers, but the $16.9 million that the governor's proposed for home visiting is consistent with what was proposed for the FY15 budget or what was spent in FY15. So it is essentially level funding. The hope is that these home visiting providers that are not being paid in FY17 and had reduced payments in FY16 will be able to ramp back up and be able to provide the same amount of services as they did in FY15, which is not a given. For the Child Care Assistance Program, we have a little more detail here and a graph for everybody. Everybody likes graphs. So we requested $151 million in increase to child care from the General Revenue Fund, and that is what the governor proposed as well. It would restore eligibility guidelines back to June 2015, so that includes the income eligibility back to 185% of federal poverty and restores the non-TANF education and training piece to child care. The governor will also implement the requirements from the federal child care development block grant reauthorization, which includes 12-month eligibility and providing services to homeless families. So DHS, our current caseload in child care is about 125,000 kids on average. We've been at that average since the end of last summer. The governor's office believes that by the end of next fiscal year, we'll be serving 155,000 kids in child care. So we back up to kind of the average number we've had over the last 5 years. However, so that the average from the beginning of the fiscal year till the end of the fiscal year, they see about an average of 140,000 kids on childcare throughout the year. So this aligns with our request. Again, this is part of the good, the governor recognizing that the restrictions on childcare were a bad idea, and with the fully funded budget that he's willing to go back to where we were before. However, like we said before, there's not necessarily enough revenue to pay for all this. Next, we have the early intervention budget, which is also in the in the Department of Human Services. You can see the spending. We went up from in FY16, we spent about $85 million on early intervention, and this year they're estimating to spend a little over $90 million. So we are going to get back up to and then next year they're expecting a little more of an increase spending for early intervention. So we are requesting $96.7 million, and that is what the governor is proposing as well. Home visiting line, we spoke about that just a minute ago. We're requesting flat funding from FY15, and that is what the governor is proposing as well. And again, we're hoping that providers who are not getting paid and who have to let staff go can actually get back up to this level if they know funding is coming starting July 1st. Moving on to the State Board of Education budget, the Early Childhood Block Grant. It's been proposed, the governor's proposed a $50 million increase, which is consistent with what the State Board of Education has asked to receive. This meets two issues, two requirements. One is we have a federal grant, about $80 million for preschool development grants. And in that request where we received the funding, we had said we would raise our preschool spending by $50 million a year, and this is the third year of that, and we have met that requirement so far, so we're happy to be going forward. We've always had investments in early childhood education, in preschool and preschool for all, and this just continues. This is getting us back to where we were in FY09, where we were serving 95,000 kids. The additional money here we can add another 6,600 kids to childcare and actually provide even more, to preschool and actually provide even more comprehensive services. So while we're going to have a hard time getting back to to serving all 95,000 kids that we were back in FY09, we think we're going to be serving children with higher needs and with more comprehensive services so that they get an even better start going forward. And then lastly, our last budget, which budget line which we're watching is bilingual education. This again is in the State Board of Education. We requested $38 billion, and this aligns with what the level of billing is for providing additional services for teachers or supports for teachers to receive bilingual training and to get bilingual certificates to serve the needs of bilingual children. So the last 2 years, actually, the State Board of Education has received billing of over $100 million for these services. And beginning in FY16, they actually had to prorate what they were paying back. So they were actually paying 68 cents on the dollar for what was being, or 63 cents on the dollar for what school districts were billing for. So this year, in the goal to end proration, which they already ended proration for the K through 12 system for general state aid, they're hoping to end it now for bilingual, and also they have proposed ending it for transportation services. So their goal is to pay districts exactly what they've asked for instead of prorating what districts are getting back for the services that they're providing. So, I know this is really detailed, but I hope you get an idea of what we're following and what we're tracking over time, so you can see how early childhood services are faring. So I think the big takeaway from this is the need for revenue. Again, the governor proposed a budget that is at best $4.6 billion out of whack, and at worst $7.2 billion short. So the idea here is the state needs revenue, and we need to advocate for revenue, because anything short of that $7 billion in revenue is going to mean further cuts, or not getting back to eligibility in childcare or serving more children in preschool. So without the revenue, we're not going to be able to pay for the investments that we all know we need. All right. Do we have any questions before moving on? All right, well, I see a question here. Will I be getting paid in March? Sorry. Well, that is a good question. So, I think there was some concern because home child care providers are getting paid out of a court order, and that the court order specifically that provides payments for home child care providers is the St. Clair County case that also pays state workers. So when the Attorney General filed a motion to stay that order so that state workers would not get paid because she believes it's unconstitutional to make payments without an appropriation passed by the General Assembly, that would mean that home child care providers will not get paid as well. So that case actually went to the district court or the county court in St. Clair County, and they refused to lift the stay. So as of now, unless the Attorney General decides to pursue this case up to a higher level, at the end of this month, there will be no payments stopped for state workers, so child care providers should continue to be covered. All right, are there any other questions?
Oh.
All right.
Sorry. All right, and this is Ceci. We'll also have time at the end for questions. This break was meant specifically to give you guys a chance to ask budget-specific questions, but clearly if you have some budget questions at the end, we welcome those as well. So we're going to not necessarily shift, but kind of move on to things specifically about our policy priorities this year. We're already almost at the end of February. Our legislative session kicked off in the middle of January, but it was a slow start in terms of infrequent days, waiting for committee appointments, leadership shifts in terms of the leadership in each of the caucuses. So that's all settled, and we are kind of going gangbusters in terms of tons of bills are being introduced. Committee hearings are underway. Samir is down in Springfield this week with the House in session, and next week the Senate is in session. So really trying moving stuff along. And we're in that mix of lots of bills that are being introduced. I just want to remind folks, or for those folks who are new to Illinois Action for Children and our webinars, just let you know that our policy priorities at Illinois Action for Children are all mostly kind of driven by three primary factors. One is what we feel, what we hear from you all in terms of from providers, but also in terms of what we're hearing from communities and from families, specifically in terms of the struggles they're having in accessing early care and education, in paying for early care and education, in getting the different programs that they need to work together. So, just all kind of feedback. We have over 70 folks at Illinois Action for Children across the agency whose job it is to be in communities, really working directly with families, communities, programs, and providers. And so we really do take that, our statewide membership, but also our programmatic work at Illinois Action for Children, and have that inform our policy thinking. That gets combined then with research and what we know is best for young children, and really making sure that we are research-driven, that we are really thinking about what we want for families, what they need, what's good for young children, and then how do we create and build a system around those core principles. And then thirdly, we really look at the opportunities, right, are the external climate and the environment in which we find ourselves. And so sometimes there are opportunities presented, and sometimes external realities kind of force our hand. So one example would be really thinking about what happened in July 5th of 2015, and really how does that drive what we've learned since then in terms of the impact of the cuts to child care then, and how do we respond now legislatively. The other example would be the Child Care and Development Block Grant was reauthorized. The state has submitted and had approved a state plan in terms of implementation. So are there priorities born out of that? So we have the Preschool Development Grant to the state of Illinois from the Department of Education, and that requires us to further invest in our Preschool for All program. So those are really the three drivers in terms of identifying our policy priorities. Maria's going to walk us through them and kind of give you a little bit of each one of those things that have gone into our thinking and into our preparation. We like to think of ourselves and pride ourselves on being thoughtful policymakers, always thinking about the unintended consequences as well as the intended, and really working with the state agencies in terms of thinking through implementation process as we think about the legislative one as well. So with that, I'm going to turn it over to Maria Estlund, who's our policy associate, and her leadership in Springfield, and really helping us think through these priorities. She's the perfect person to kind of walk us through this. So with that, I'm going to turn it over to Maria.
Hi, everyone. This is Maria, and our first policy priority is to restore access to CCAP. And as Samir said, after the July 2015 changes to CCAP, we saw a drastic reduction in our caseload. We did see an uptick around May, but it's remained flat since then. And it's around 125,000 kids, which is about 30,000 fewer than what we were serving 2 years ago. And we haven't seen any uptick since, like we said, last May, so almost a year ago. So part of that reason is that two populations remain ineligible for CCAP, and those are families earning between 162 and 185% of the federal poverty level, as well as parents enrolled full-time in non-TANF education and training programs. And the governor has previously committed to restoring income eligibility back to 185% when the state has a full budget. And because of that, our advocacy for that piece has really been on our persistent advocacy for responsible budgets we put back into place. And even though his proposed budget does include a restoration for both income and training and education pieces, we still think that it's really valuable to move forward on the education piece. So we've introduced a bill with Representative Wallace and Senator Hutchinson, and this is really informed by our feedback from providers in the field who have said that the education piece has really impacted programs and families. So this would add parents enrolled in non-TANF education and training programs to the priority populations. It restores access for around 4,000 kids. Oops, sorry. And our next priority is to support early childhood and K-12 alignment and partnerships. So Head Start and state-funded early childhood programs. Sorry about that, I lost my place. Head Start and state-funded early childhood programs are required to support smooth transitions sorry. Head Start and state-funded early childhood programs are required to support smooth transitions of children out of the program and into kindergarten, but there's no similar requirement. I'm very sorry. Samir, can I have you take over for a minute?
Yes, sorry, no problem. Let's see here. Right now, the new federal law, ESSA, the Every Student Succeeds Act, requires students have a smooth transition from early childhood to kindergarten, and it's something we obviously feel passionate about. So we're running a resolution this year that would put a committee together to determine some best practices in the transition from children moving from early childhood to kindergarten, regardless of the setting. We know that children that are in preschool programs and school districts may get a better transition than children who are in home child care. So we believe this is extremely important in continuing the success of our early childhood system into the K-12 system. Last year there was also a bill that would continue the success of children from high school into higher ed, and we see this as the need as being similar. So we have a committee that will develop a framework in the end, I believe, by the end of February next year. And again, it's to encourage best practices for supporting transitions. We'll engage families, we'll collect data, we'll share the professional development opportunities, ensuring that teachers in the K-12 system do understand what a child who's still in kindergarten needs early childhood-wise. All right, our next priority is going to be preventing expulsions in early childhood settings. There's a lot of national research here that shows that children in early childhood programs are actually expelled at a much higher rate than those in the K-12 system, up to 3 times more likely. Also, obviously, children not going to or not participating in early childhood programs, either being absent, truant, or being kicked out of programs, are much more likely to have those same issues going forward in the K-12 system. So being expelled is just another indicator of what children are going to do in later school years. Boys are 3.5 times more likely to be expelled than girls, and African American children are 2 times more likely to be expelled than their white and Latino peers, and that includes African American girls as well. And then, the Chicago had an unmet needs study that found a high rate of expulsion in infant toddler programs, with 40% of the children of child care providers asking children to leave for social, emotional, and behavioral issues. So from the research and from what our mission is, we understand that it's not easy for providers to care for children that have some behavioral and emotional issues, but these are actually the children that can be the hardest to reach, and these are the kids that actually need to be in the right setting so that they can be better prepared for success later in life. So we have introduced the bill with Representative Stratton and Senator Lightford. Senator Lightford herself had an issue as a child. Her brother was kicked out of an early childhood program, and it really set some things on edge for her family for a while. So she was really happy to work on this bill. We've amended the language of the bill we had previously that we introduced last year, and we really tried to hone in on what our providers, what the feedback was from our providers. So the goal of this bill is to ensure early childhood programs engage in best practices and their disciplinary actions by prohibiting expulsions. Planned transitions, I think this is extremely important, is that if you're doing a planned transition with consent of the family, after exhausting or trying to access some services, that those will not be considered an expulsion. So the idea is that providers, we want to give providers tools to stop, take a look, make a few phone calls, whether it's to a mental health consultant, from the R&R or to the Easter Seals or something for a screening before just telling parents or making it uncomfortable for children and parents to be part of their program and transitioning them out. Additionally, I think what's extremely important, especially from our feedback from providers, is that they don't often know what supports are available for them. So what this bill puts in place is a system that would track the transitions, but also collect the data on how long it took for providers to get in to get the child in for a screening, or to get somebody out from the R&R to shadow a child, or to look at the classroom. And also if parents are actually wanting to be involved in the process. So, this idea really stems from, there was a couple of years ago, there was a bill that prevents expulsions, passed in the General Assembly, that prevents expulsions from the K-12 system. So we want to ensure that those protections for children in the K-12 system are there for children who are being who are receiving grants from the State Board of Education and preschool programs. Additionally, the bill would move into licensing of child care centers and homes, with rules being adopted by DCFS that would align with what's being amended in the school code. So, I mean, essentially, and we have an FAQ on this bill and a fact sheet as well, but just to walk through it briefly. When a child exhibits consistent challenging behavior, this bill would ask early childhood providers to make adequate attempts and to document and address the child's needs. So communication and participation with the family is important. An intervention plan and strategies, including attempts to access some external resources like a mental health consultant, or if they need a screening for an IAFC or an IEP. And, we want to make sure that what's documented is when children are transitioned out, so we know why and who, so that we can track, we can have better data to inform the field. All right, and then our last priority, I believe, is going to be, we need to maintain investments in school readiness and in school readiness initiatives. We've invested over several years since getting our Race to the Top grant, and even before, in a quality early childhood system. So we believe the state should maintain these investments with the Race to the Top grant ending in December, or ended last December. We want to continue to make sure that we're supporting Accelerate. We want to make sure that we're continuing supporting Gateways to Opportunities, which is now going to be an important place for providers and teachers to track the trainings they're doing to maintain their licenses. And we've been working really hard on a systems approach to children, not just education services, not just health services, but all kinds of services that families and children need combined together, so that we're servicing the whole child and the whole family, not just one part of their life. So we want to make sure that these systems of quality are maintained. All right. So those are our 4 big priorities this year, besides the budget. So I guess that's 5. I guess that budget one is probably the biggest one for everybody. So what are your next steps? Guys, you need to continue to call your legislators and the governor and pressure them for a solution. We need a solution for FY17, which we're in the middle of. We need a solution for FY18 going forward. And we obviously need adequate revenue to fund these investments that not only the governor wants to make, but that are required of us through some federal changes to ensure that we're serving all the children that we can. So going forward, our upcoming events, we have a conference that we hold every year in Springfield. That will be March 28th and 29th. We have our Early Childhood Advocacy Day on May 9th. We're going to do a joint one with the Onset Prevention Fund. It should be big and fun. And then we have our statewide policy caucus, where we wrap up the legislative year in June 22nd. Hopefully, fingers crossed, this year we actually have an end to the legislative session with a fully funded budget. So, this was, we're really happy you all could join us today. We have a few links here next if you want more information. We'll also be sending out, I already saw there was a question, but we'll be sending out this PowerPoint and our priorities and any fact sheets we have, we'll make sure to get in your hands so that you know what we're talking about, and you can do your advocacy going forward. So thank you again. I think we will take questions now. All right, so let's see here. I think somebody did ask if we have slides with priorities. Yes, we will get those. We'll actually get the priority fact sheet to you, so you don't have to go through the webinar again. So there's a question about the resources for centers, and I think that this is exactly what we're trying to get at with the expulsion bill. We need to know what resources you try to access every time you transition that child out. So it's not really about second guessing what you're doing. It's about finding out what we have. It's about finding out what you have access to, and hopefully using all the people that come into your program, whether it's a healthy food program representative or a DCFS licensing representative coming in and actually providing you with numbers and places to call when you're having behavioral issues with children. There's a question about, again, the expulsion bill about harming children. Again, there's no, if other children are in harm's way, you will be allowed to remove children from the educational setting. So we don't see that as an issue with the bill. So another question about mental health and support services. Yes, that's what we're trying to get at. We're trying to ensure that not only are there enough resources, but that you have access to them. And if you're not getting access, then we need to work on having more services available to you, like more mental health consultants, and to ensure that we're paying providers on time as well. So there's a question about eligibility here. Will the maximum family income to qualify for DHS, I'm assuming that's for CCAP, will it change? So right now, we have restricted eligibility. So in statute, eligibility for child care is at 185% of federal poverty. So that's around $3,000 or $3,100 for a family of 3 a month. And right now, under the restricted eligibility of 163% of federal poverty, we're at about $2,700 for a family of 3. So yes, if we get a fully funded budget, the income to qualify for child care would go up. Any idea when funds will be used for current grant programs? Actually, I do not. I have no idea. I think the problem is that with the current spending, even without paying for grants, we're spending more money than we're taking in. So, current grant programs without an appropriation cannot actually receive their funding even with a signed contract. So your programs will get paid when we have a budget. So it's important to advocate for an actual budget, not a continuing resolution or a continuing budget going forward. So, and again, we've seen that when that if the budget does not have enough revenue, your grant lines could be removed. So, for example, Teen Reach. In 2015, the governor proposed eliminating Teen Reach, but since that bill did not pass, the DHS passed out contracts for Teen Reach, which then didn't get paid, and now they're going to be eliminated again. So it's important that your line is in a budget if you have a contract, because otherwise they can say that they're not going to pay you. Again, the Lisa Madigan lawsuit, I think there's another question. If it goes, So right now it's not being heard in St. Clair County. It has to go up, I believe, to the Supreme Court. If it gets heard in the Supreme Court, it would depend when it gets heard, when it would take effect. So, the ruling could occur and it could be immediate, stay unpaid, stay workers, and then that would include home child care. But it could also be a date in the future. So, we'll be watching that, closely, obviously, and we will keep you up to date. So I actually did not mention, somebody has a question about revenue possibilities. I did not mention any of them. We can send you guys a list of them, but the ideas include obviously going back to the 5% income tax rate. That income tax rate would bring in from now, it would bring in about $4 billion a year additionally. So if you think about if we had $8 billion over the last 2 years, we would not have a $12 billion back bills. There's also, there's this $4 billion is not enough, and I think the governor even in his proposal showed that $4 billion is not enough to fill the budget hole. So, additional ideas are a tax on sugar-sweetened beverages. That's estimated to bring in about $600 million a year. If that all goes to Medicaid, that would be doubled, so it would be about $1.2 billion a year. There's talk about taxing retirement income in the state. There's no income tax on any of your retirement income, whether it be a pension or a 401k or an IRA. So there's thought of including that in there. There's you could also have revenue without taxes. We could bring in casinos. We have more casinos. So we could change the lottery system, or we could try to sell more lottery tickets. I mean, there's a lot of ways to bring in revenue, but the big, obviously the biggest and somewhat easiest place to get revenue is through an income tax, although that one is arguably the most politically hard to sell. Let's see, there's a couple more here. Another one about the expulsion bill. Again, the idea is if a child is a safety hazard or is causing a safety issue in the classroom to other students and teachers of that child, can be removed from the educational setting. However, the idea is that the idea is that the child is not just immediately expelled from the program. The parent and the provider would work together to find the supports for the child. And if your program is not the place to provide the supports, or if the parent does not want to engage in that conversation, then the child can be transitioned to another program. So again, there's nothing here trying to second guess what you're doing. It's more about just pausing and taking a second and trying to work more with the child, because that child is going to need arguably needs the supports that are out there, and they actually need more supports than some of the other children. What are the chances that we will stop being funded for the rest of FY17? Well, because we have, the federal budget's passed, the appropriation statewide is passed. We have about 70% of the child care program already funded. So chances are low of not being paid unless we actually run out of money. But that doesn't mean that child care providers tend to be one of the first in line. They take priority when the state is paying. And then but I believe that, again, it's important that we have a budget for FY17 and a budget for FY18. So these are the priorities that we need to these are one of the priorities that we need to talk to our legislators about, and that is probably the pressure that we need to be putting on them every single day. I don't want to tell you you're definitely going to get paid all the way through FY17, but the way it's structured now, child care providers should be okay. Also, if you have a Preschool for All grant, the State Board of Education funding was fully passed, so there's no issues in getting your grants from there. All right, I think that is all with the questions. Thank you so much, everybody, for attending today. Again, we will send out the slides. We will send out our priorities as well. We'll send out our fact sheets. If you guys have additional questions, I believe you all have my email. I'll just tell it to you. It's Samir, S-A-M-I-R, Tanna, T-A-N-N-A, at actforchildren.org. You can just email me directly, and I will try to answer your questions the best I can. Again, thank you so much for attending, and I hope you all have a great day. Thank you.